So the last section that I want to go through is, as we said before, social isolation and quarantine has shown to have an impact on people's mental health. And sometimes coming out of quarantine can be difficult as well. And being isolated and distanced from other people for an extended period of time has its own unique set of reactions that sometimes people are surprised by. There's a sense of mixed emotion, everything including relief after the quarantine or the isolation is rescinded, to actually an ongoing fear and worry about their health, that it almost feels dangerous that the quarantine is lifted. They've been living with a sort of focus on their health, their fears about their health, their fears about their loved ones. And it does not help when we see in the media that, different places around the world are telling their healthcare workers to make sure their will is up to date and all those different things. It doesn't help to hear those messages. So it can feel equally upsetting to have the lifting and to have those freedoms reinstated, that we go from the sense of being hypervigilant to the signs and symptoms going on in us and being monitored by others and checked in, to suddenly be free to return back to work or level of functioning. And it can create that same sense of danger, fear, anticipation, or dread. So what do we see as being the most common reactions? Well, first of all, when we are in isolation, then maybe we feel anger at maybe the exposure, the source of the exposure, maybe even the mandated isolation. Maybe we feel that sadness because of the disconnection. Maybe what we also do is feel more disconnected because our friends, our family aren't checking in on us. Or maybe we start to resent the fact that they are afraid of us in isolation, those in isolation, because they're afraid of contracting the virus or disease from us. And that we might sense that people are distancing themselves or wanting to stay away because of that exposure. Another aspect that we see is that people feel that when they are having to isolate because of a possible or actual exposure, that they feel like they're letting their team down at work, that they're not able to perform, they're not able to contribute, and that they have this inordinate amount of guilt about that. But also that the quarantine takes them out of those normal parenting duties or shared responsibilities, and that they feel a sense of letting their families down as well. And we start to see all sorts of unpredictable and almost anticipated range of emotional and other mental health changes that I talked about earlier, from that acute stress reaction, anxiety, depression. Like I said, the research later says that 3 years later, we can even see that there's increased risks of development of some of the more formal mental health diagnosis like PTSD. In no way does quarantine, are we saying, guarantees that you're going to go on and have a mental health condition or disorder, but it does increase the likelihood. Well, I want to bring up our last slide and say that if you've watched this video, and again, thank you for the participants from our frontline healthcare workers, Nicole, Eric, and Leanne. If you do feel that after watching this, that you or somebody that you know is in need of more resources, what we would encourage you to do is reach out to the most appropriate and imminent resource based on that person's need. Everything from 911 to somebody who might be a risk to themselves or others. If you have access to your local peer support team, either on site or through your healthcare organization, access them. Through the Alberta Healthcare Health Links line, the suicide and crisis numbers that are available in most communities around Alberta, Canadian Mental Health Association distress line, and Edmonton and both in Calgary. There's a multitude of resources available, and if you through your employer have access to an employee and family assistance program. There should be the availability of receiving both online and telephone support during this time. So seek out those numbers. And as we conclude, are there any last comments or questions that our panel has before we end today's session?
The only thing, well, first of all, thank you for putting this on. I just wanted to reiterate something Nicole said earlier that really, I think, needs to get out to staff is how amazing they are stepping up to the challenges, like the good stuff that is coming out of this, right? So I think it's really important to be mindful of the hard work and the stress that it's causing, but also, like you said, that there's some things can good come out of this, and hopefully we can move forward in some really good programs that come from all this. So.
Yeah, Jeff, just want to reiterate, just thank you for doing this presentation. I think a lot of staff and frontline healthcare workers will find it very helpful and useful in the days and weeks to come.
Thanks.
My turn for my thank you. I think for me, it's been a really good reminder that the principles of stress management in an acute situation, they can be transferable to this crazy pandemic, who knows how long, completely ambiguous situation. And if we can focus on what we know we need in ourselves to be resilient and to cope with stressors, that should be our first checkpoint and our first stop to make sure that we're able to care for ourselves, because as healthcare workers, we are in the position to care for everyone else, and we can't forget to take care of ourselves first.
Absolutely. I want to thank you guys for dedicating your time and agreeing to participate in this. Our very last slide that will come up will be a website and a resource for individuals who might want more information on coping with stress, talking to children and teens, and coping with family. The website belongs to the Alberta Critical Incident Provincial Network, which is a provincial network of public safety personnel and hospital-based teams that come together to support each other, and that it really is a knowledge base and resources for people to access. And so the website address that you see on this slide, it's every information on there, every bit of information belongs in the public domain. Please use it, pass it along, and that you are given permission to share this video as widely and distribute it, post it, Facebook, anywhere that you see fit that our healthcare workers will see it and benefit from it. There is no copyright, there is no control on it. We've done this as an organization to recognize the impact that our healthcare workers, the level of stress and duress that they're going under and have the potential to go under, and that we just wanted to put something together that helps them continue to do what they do, which is helping us civilians through our worst day and through our medical emergencies and difficulties, and keep them safe. We need them in place, and that's what we're committed to.